Hello everyone. Well, last time when I attended the ECHS dental officers interview, most of the candidates who had appeared for the interview for the first time were asking like what questions are usually asked. So I would like to tell you, first of all, the type of questions asked depend on the panel of officers who are conducting the interview. And secondly, when you enter, you are asked to introduce yourself. So there are various ways to introduce yourself. You can say, hello sir, my name is this and I am working at that place. Or you can speak in a better manner like, hello, my name is this and I am currently working at this place. I had done my graduation on the year of so and so. Or if you are a postgraduate, you can say I had done my post graduation in this year. And if you have done any short study and published articles, you can mention that. And if you have done any community service, if you have given, you can talk about that. So it should be really crisp. And coming to the academic part, well, when the number of candidates are less, and also it depends on the panel of officers. When for the first two times when I attended the interview, as the number of candidates were less, so we were asked from the academics. And from the academics, the questions can range from anywhere, like you can be asked if you are a general dental surgeon, you can be asked from lip fractures, then suture materials and local anesthetics, the concentration of adrenaline, and also about little bit about the medical emergencies, also the endodontics like BMP, etc. And even if you have done your post graduation, it's not necessary that they will ask you things from your post graduation subject. They may, if you are a prosthodontist, they can ask you from the materials, then they can ask you about the endoperiolesion, they can ask you about the burrs, from inlay onlay, your questions can be, and again a little bit can be asked about crown lengthening, then something about the radiographical features, and they can jump even into the dental anomalies like the congenital anomalies that we read on oral pathology. Like they will give you a situation, clinical situation, and they will ask you, for example, if what is the radiographical feature of internal resorption, and then on the contrary they will ask you about the situation in internal resorption, there is widening of canal, and they will ask you on the contrary which is the situation where radiographically you cannot identify the canal radiographically. So you really need to be swift enough to answer them. This is dentinogenesis imperfecta, although this is just an example. But when the candidate number is high, it's unlikely that they get really deep into the academics. They mostly stick to the introductory part, and also they ask why you want to join. So that answer need to be really logical, like if the location favors you, and also if the timing favors you, and also if you feel good treating the ex-servicemen. This you need to keep in mind. So there is no exact question that are asked, but these are the things, and you really need to be thorough about the parts of dentistry. And it's not necessary that you need to answer each and every question and then only you can get. It depends on the criteria they have set basically, but you need to be your best. So all the best.